Yeah, so look, there's a lots of different overlaps between eye exercises, orthoptics, vision training, vision therapy, neurooptic metric rehab. So they all use activities to develop skill. Some of the labeling comes from the philosophy behind it. So orthoptics and eye exercises take a more mechanical approach to what the visual system is doing. So it's about moving the muscles around. Vision therapy from a perspective of a behavioural optometrist is you're wanting the person to learn how to understand where they are in space and how they coordinate, and their eye movements are just part of that overall understanding where you are in space and when judging where other things are in space in order to behave and act in the world. And so some of the activities on the surface might look the same, but the emphasis might be a little different, or how far we take them and practice them from an outcome point of view is quite different. And so, if we're doing a convergence activity to try and train someone whose eye teaming, becomes uncomfortable here, for us, it's from someone from a behavioural vision care perspective, it's not about just pushing and pushing and pushing the muscles, because if we do like an NPC, or if we just want to look at a pencil as an example, and we've got the two eyes turning on it, there's not a lot of difference between turning that eye by itself that way, this eye by itself this way. How come you can't do it together? It's not about the muscles being a problem. It's about your brain understanding how to do the activity. And so it's how we're directing attention to the patient and getting them to really understand where they're looking. And so that's where there's a much more of a therapy component about it. And that's a much more useful, we think, way of looking at vision, because ultimately it's got to be good for something when you train it. If you just train someone to kind of push their eyes together, doesn't mean they can do it in the real world when they're trying to think of other things. And then neurooptic metric rehab is vision therapy, but part of what comes on when you do additional training in neurooptometry, you need to understand that the way those vision problems might present differently. You also need to work with those patients a little differently as well, because some of the things, you've got to take things a lot more slowly, because often movement in their in their peripheral vision is quite triggering for them. And so it's not a matter of just being good at vision therapy, it's also understanding that category of patient and how you have to work with them. Even though, again, on the surface, the activities might be the same, but it's more you change the way you execute them for that population of patient.